Good evening, I'm Jessica Djukic. Governor Tony Evers traveled to Wausau today to expand the access of health care. The governor signed 5 bipartisan bills to improve access to dental care. The bill signing was held at North Central Technical College to make access to dental care more attainable, especially in rural areas. The 2019-2021 budget signed by Governor Evers provided an additional $2 million for the DHS oral health program, including $1.2 million to increase funding for dental clinics that serve low-income patients. The new bills signed by Governor Evers will help improve the ability of technical colleges across the state to support and strengthen the dental and oral hygiene workforce. The bills will also authorize the licensure of dental therapists who are healthcare providers who may engage in the limited practice of dentistry. The U.S. House of Representatives passed a $78 billion tax package with bipartisan support on Wednesday. The Tax Relief for American Families and Workers Act of 2024 was passed in the Republican-led House with a vote of 357 to 70. Wisconsin's Republican Assembly leader is downplaying pressure he's receiving from former President Donald Trump and fellow GOP lawmakers to impeach the nonpartisan elections administrator. Today, Assembly Speaker Robin Vos spoke out about Republicans trying to oust state elections administrator Megan Wolf. The Senate voted last month to fire Wolf, but later admitted the vote was symbolic and had no legal effect. A group led by election conspiracy theorists launched a 6-figure TV ad campaign last month threatening to unseat Vos if he did not proceed with impeachment. Vos says they're not going to vote on impeachment anytime soon. Vos has previously said he supports removing Wolf, but he wanted to first see how a lawsuit filed on her behalf to keep her in the job plays out. The Assembly can only vote to impeach state officials for corrupt conduct in office or for committing a crime or misdemeanor. Nearly $6 million in grants will go to Wisconsin businesses in order to cut energy costs. The money was made possible through the Inflation Reduction Act. Senator Tammy Baldwin helped deliver the grants, which are through the Rural Energy for America program. Grants include $100,000 for the Tomahawk Terminals Company to install solar panels. Those panels will create enough energy to power 9 homes. Then in Wausau, around $150,000 will help a hotel operation make efficiency improvements to the elevator system, which is expected to save the company $50,000 a year. Freedom is one of the principles this country is founded. Unfortunately, that hasn't always applied to everyone. Until 1978, Native people were prohibited from honoring their traditions, speaking their language, and even practicing their religion. Now, tribal members are reviving those practices and celebrations. Fun in the sun could lead to emergencies, but knowing where to go for an incident can help save time and money. In tonight's edition of Feel Great Today, we'll explain the differences between the emergency department and urgent care and where you should go for certain situations.
Feel Great Today with Jessica Djukic.
Summertime brings more people to the lakes, so we see an increase in population alone for that, and of course a lot more water-related injuries.
Dr. Rick Mayer is an emergency physician at Aspirus. He says the emergency department handles traumatic injuries.
On the more severe side, it's going to be the horrible car accidents or falls off of roofs or boating accidents or snowmobile accidents and heart attacks and strokes and horrible things like that. All the different ailments like pneumonias, congestive heart failure, kidney stones, and really serious behavioral health issues too.
Less serious illnesses can be seen at an urgent care or walk-in clinic.
Walk-in clinic, supposed to be more about things you would go to your doctor for, but it's an unplanned illness, earache, toothache, maybe some rash and things like that, or perhaps some mild injuries, things where you wouldn't need a whole bunch of x-rays or CAT scans.
The emergency department is swamped in the summer, so Dr. Mayer says use your best judgment. He says they see a spike in water injuries along with heat illness and alcohol-related accidents.
Not the good time to go picking up your chainsaws and doing chores and things like that. Staying well hydrated is super important, and it's sneaky because you're in the lake, you're out of the lake, you feel like you're kind of cool, but alcohol use make you more vulnerable to heat-related illnesses.
Dr. Mayer says people should drink plenty of water and get out of the sun if you start getting cramps, nausea, or a headache.
That's oftentimes the heat illness starting, and you can intervene quickly by just getting out of the sun, cooling down, making sure you're not getting right back at it again to get that project done. You know, take the break and realize that we're governed by the laws of nature just like every other machine that we work, and we have to take care of ourselves.
October is Breast Cancer Awareness Month. Getting a mammogram early can save lives. In tonight's edition of Feel Great Today, we'll explain what a mammogram is and what can increase your risk for breast cancer.
Feel Great Today with Jessica Djukic.
A mammogram is like an X-ray image used to detect breast cancer.
Melissa Coyne-Gitter is an advanced practice nurse practitioner at the Aspirus Tomahawk Clinic. She says people should begin scheduling mammograms between 40 and 49 years old, depending on risk factors.
One is age. The risks go up. Family history is important. Also, dense breast, it's important to have a mammogram early so that can be detected early. Again, going back to diet, it's important to have a healthy diet free of preservatives and a lot of fat. Charred foods can also increase the risk of breast cancer, as well as alcohol and tobacco use.
Coyne-Gitter says people should mention concerns to their primary care provider.
Breast changes of concern might be skin texture changes, lumps, pain, nipple discharge, anything different that you're noticing on your own, which is important to really know your own body, your own breast tissue.
If you have a mammogram scheduled, do not wear deodorant or lotion because it can lead to a false positive.
If there's something detected on the first mammogram, you may go on to have an additional mammogram or an ultrasound. So that would be followed up on. It's important to screen for early breast cancer so that it can be treated.
With winter arriving soon, she says getting vitamin D supplements or sunlight can lower your risk.
A healthy vitamin D level has been shown to prevent breast cancer. If you could get at least 15 to 30 minutes of sun on your skin throughout the day, that helps with your vitamin D.